Hi, Dr. Pelto here. I'm going to do a little video here about ModMed for Qutenza. So this is the way we put in the sticky notes. So we put in a Qutenza case. We call it buy and bill. So these are the ones that we buy on our own and we bill it to the insurance. So here is, I'm hiding the patient identifiers here, but the patient has neuropathy kind of documented. This is all their patient stuff. These are the billing codes that we do for buy and bill. So we are actually, this should be bilateral. I haven't quite figured out yet in ModMed how to do this bilateral. So it should be 2 units because it's bilateral, and this is for the capsation. The plan is called Plan Qutenza Application. So I'm going to go through this. You pick right and left as the side. Neuropathy, you pick in, do a skin prep. We don't use any topical anesthesia. We bill the HCPCS codes. And the procedure is the 64640. And then we use 4 patches. It takes 30 minutes, so we set a timer for 30 minutes. 1120 is the amount of the product because it's 280 times 4. We do 4 patches. We monitor the oxygen sat and blood pressure, no wastage, and it took 15 minutes. Medical necessity, we just put in neuropathic pain. We kind of fill these things out, and then post-care instructions, and then other billing. This isn't a case study. So this is how we do the billing for Qutenza. And then we usually don't get this full amount. And this is whatever we get usually covers the price of the actual product. And all we get revenue on is usually just this procedure code for application. So this is kind of what we do for Qutenza. I have some notes within my Notion that I have. So Notion basically is a booklet I put where different notes on my Qutenza. So I have things for my EMR and different things like that. So I'll put that underneath this video for you if you want to see my notes on Qutenza. Certainly if you have any questions, reach out to me, Don at podiatrypracticemastery.com. Kind of helping you with these little videos. Or if you want other videos for ModMed, let me know. Okay? Great, thanks.